Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello, everyone. Super excited to be here. This is my third installment in the Future of Naturopathic Medicine episode. This is where new grads come to the show and we talk about our amazing career. And it just makes me so happy to have him here because it gives me hope. Sometimes everything we hear on the internet or we read on blogs, it's just doom and gloom. And this kind of is like the most exciting podcast of the year because I get to share with you guys some good stuff. So in the spirit of my show, I'm going to be talking to 4 different new grads: Kelly Lupo, Carly Golightly, Neil Morris, and Eric Nelson. And ladies first. So Kelly, what's your hero story? How do you come to this profession?
Yeah, so I always wanted to be in medicine. I knew I wanted to be a doctor ever since I was 3. So I was kind of going that route. But I grew up on the East Coast, small town in upstate New York. We didn't really have many resources when it came to medicine. Conventional medicine was pretty much all we had. So I was going for MD, DO school. I didn't really know what naturopathic medicine was until I was in college and a friend from the Midwest had told me about it. But, I love endocrinology. I love hormone health. This kind of stemmed from when I was a patient myself. So I was diagnosed with PCOS, which is polycystic ovarian syndrome. Basically, you get acne, you get hormone imbalance, you get period problems, all of that fun stuff that we get to deal with as a teen and in our 20s. So I saw some physicians, I saw my OB. I wasn't really getting the help that I needed, and I knew that there was something else out there that I was missing. Nothing really was working for me. So I kind of just had to suck it up and honestly wait until I realized what naturopathic medicine was. And as soon as I started utilizing that into, my own routine and my health, that's really when I saw some changes. So I saw my hormones balancing out, my menstrual cycle was becoming more regular, and my acne was clearing up. So I was sold as soon as I heard about it. It really made a huge difference in my life. So I knew that this is what I wanted to do, and I wanted to help other women.
That's awesome. And what kind of changes did you do in your life, in order to help you with your hormones?
Absolutely. So I think dietary and lifestyle are a huge thing. There are so many food triggers that we don't even realize are affecting our health. Things like dairy and gluten and other sensitivities that are very inflammatory to the body, and it can manifest in your skin. So I think, eliminating some of my food triggers as well as utilizing botanical medicines. I think botanical medicine is one of the best natural modalities that we have. We can use it so widely, and I think it really made a huge difference in regulating my hormones compared to the generic birth control, which is what I was on before. That wasn't really specific to what I needed.
Yeah, and don't get me started on botanical medicine because then we'll just blow this podcast out of the water. Carly, what about you? What brought you into naturopathic medicine?
Yeah, so I think like a lot of us who are in this field, I have kind of a winding path towards becoming a naturopathic doctor. When I think back about it, it all really started when I was in my teens. So when I was in my teens, I had a ton of digestive issues. I had been diagnosed with depression, anxiety, and someone even tried to diagnose me with bipolar disease at one point, but my mom kind of just like flat out, no, this is not right. And people had put me on a bunch of different medications. Nothing was working. Things were getting worse. And I was just kind of left in this spot where I didn't know what to do and where to go. So I started looking for other options. And through my own education, I discovered nutrition, I discovered supplements, I discovered exercise. And through these things, I was able to kind of just piece together almost a treatment plan for myself that eventually led me to where I am today. And similar to Kelly, I actually wanted to go into conventional medical school for a little while too. I had taken the MCATs. I was all squared away to go to a school in Miami and become an orthopedic surgeon because I thought for sure that was it for me. And I had a change of heart. I realized that wouldn't fill my soul, and that didn't meet what I really thought healers should really be doing, or at least not in my definition of a healer. So I ended up going into naturopathic medical school, and it was the best decision that I ever made. Now I am in San Diego, California, and couldn't be happier about it. This is my hometown. It's where I grew up. And I'm so happy to be able to treat the people that helped me become who I am today. And I do that mostly through hormone health and metabolic mastery. So these are two of the things that really got me on the right track. I'm also very passionate, as you can imagine, about fitness and exercise, as that's been such a big piece of my path as well. And I do like virtual consults and home visits. So I think that we as naturopathic doctors have so much to offer people just outside of what the conventional medical system offers. And my mission is really just to empower people in a way that I wish that I had been empowered when I was younger.
That's awesome. I'm gonna circle back, and I'm gonna ask you about metabolic mastery. So that sounds like some badassery that I'm not aware, and maybe I need to get into that train. Eric, what about you, man? You're from Canada, so tell us about your hero story.
My hero story. I love the term hero story, but so I'm from Calgary, Canada. I'd say it's a little bit different than both Kelly and Carly in that I didn't necessarily have any personal health conditions or concerns that I was trying to work myself through, but I was on the path to allopathic medical school as well. I had written my MCATs, I had done a couple interviews, and things were going well. But at the same time, my wife, my now wife, at that point, she was my girlfriend, but she was actually looking into different medical programs, and she ended up stumbling on naturopathic medical school down here in Tempe. And she kind of started just like all good spouses do, they start throwing in these little daggers like, hey, have you thought about this? Hey, have you heard about this little thing? Kind of resonates with you. It kind of looks like it would look good on your lifestyle type of thing. And she started to lay a little bit of groundwork and made me question kind of why I wanted to go into medicine in the first place, how I wanted to treat people, and whether or not I was going to get the tools necessary in traditional medical school to treat people the way that I wanted to. Which kind of encouraged me. I basically realized that I wasn't going to get any nutrition training in allopathic medical school. So, of course, I went out and I started doing precision nutrition training and started getting certifications on my own. I love that. I knew I wasn't going to get any real physical medicine training until residency or fellowship. So I decided to go get started to become a personal fitness trainer. So I got that certification. I started seeing clients there so I could learn that stuff. And then as I was going through the interview process, my wife, Michaela, she just threw in one of these, hey, you seem to be piecing all of these different things together. Well, there's this school down in Tempe that I applied to that actually teaches all of these things in one program. It's 1 4-year degree. You don't need to piecemeal your education. You don't need to go and get extra certifications. You don't need to do the functional medicine after you graduate, because you learn it all in one place. And that was enough to get me at least to come down for an interview. And to be honest, the interview process is what switched my mind completely on naturopathic medicine. I didn't really know what I was getting into, but doing the tour, shadowing some of the student rotations, shadowing some of the clinic rotations, you got the vibe from that school that this is exactly what I'm looking for. It's a whole bunch of like-minded people that want to empower patients, just like Carly said. They just want to empower patients to take control of their own life so you don't have to rely on the doctor or whatever provider. So you basically was just she kind of like put the little pieces of candy in front of me. I followed them, and that's how I found myself in naturopathic medical school.
And Michaela graduated with you. So that's awesome. So we got 2 for 1 with you.
Exactly. She deferred a full year so that I could get my stuff together. And then we matriculated together.
Oh, that's awesome. What about you, Neil? I see you over there, you just won a big tournament, but before we talk about JITS, What's your hero story, dude? You have a pretty cool one. I already know it, but it's a good one.
Yeah, so I was originally born in Michigan. I was raised in Florida, and I played football. I played all through high school and into college. And after football, I started having a lot of neck issues, and I would have a lot of headache. And I wasn't getting a lot of answers. Obviously they want to put you on pain medication and stuff like that. I did go to an orthopedic surgeon, and he recommended that I do a cervical fusion. So I started the chiropractor thing. I'd get a chiropractor, they adjust my neck. I would be out of pain for about 2 weeks or so. And then I just have to keep going back. Much like Eric, I met my wife, then girlfriend, and she was like, hey, I know this guy. He's a naturopath. And like I said, my background's in nursing. And I was kind of like, I don't know what that is. And she's like, just go to him. He's really awesome. So I went to this physician. He did a couple things on my neck, similar to like a manual manipulation, like a chiropractor. And the pain was better, but it came back in 2 weeks, just like, it always had. And I went back to him. I said, look, it's back. It's the same. I'm just thinking, it's the same. He said, listen, he said, I can keep doing this to your neck, and you can keep coming back to me and keep giving your money. But I think you're a great candidate for injection therapy. And if we do injection therapy on this, you have a really good shot of the pain going away. And I was really kind of like, you know what? I know my option was a cervical fusion, and I knew what that meant. And I'm just like, you know what? I'll do it. So I did the injection therapy, and I went 3 months with no pain.
Wow.
Yeah. And actually, when I did the injection therapy, I'm like, when do I come back? And he was like, you call me. And I was like, okay, that's different. So then I came back in 3 months, got injected again. And then I went without pain for a really long time. And at that point, like I said, I worked in nursing for a while, and I was either going to do nurse anesthetist or nurse practitioner. And both of those are 2-year programs. And after my second injection, I was just like, what is this witchcraft that I've never heard of? Because I'm like, I've never heard of this. I was supposed to have a cervical fusion. I was putting duct tape on it, and literally now I'm having no pain. And I actually reached out to an orthopedic surgeon that I knew in Florida, and he was from Haiti, and I was talking to him about it. He goes, oh, Prolo. He said, we do that all the time. He said, in Haiti, we had to do it all the time because we couldn't take everybody to the operating room. And he's like, yeah, it's great. And I'm just like, all right, you know what? I got to learn more about this. This is what I want to do. I want to be a product of the product. And that's what actually I started looking at the different schools, and I found SCNM.
And what is the witchcraft? What is this Prolo? And we have two experts here. You and Neil and Eric. You are the current PRC. It's not the PRC anymore. The Neil Riordan Center for Regenerative Medicine. You are the resident. Can you guys give us? Maybe you start with this, Neil. Can you tell us what regenerative injections are? And then if he's missing any points, I'll throw it out to you, Eric.
All right. So the whole point of the regenerative injections is to get your body to heal itself and to utilize your body's own ability to heal itself. So you're causing a inflammation response in a certain area without the injury, and it's allowing the nutrients and the cytokines, and you can list out all the interleukin this and all this kind of stuff, but you're causing the body to come in there, clean out the area and heal the area and become vascular, allow blood flow to get in there, because after you have an injury, the blood flow really diminishes a lot. And a lot of it has to do with scarring. And then that's how that chronic pain just stays there and on and on and on. Eric, you want to chime in, see if there's something
Yeah, well, I mean, just to kind of delineate it a little bit, there's kind of the umbrella term, which is regenerative injection therapy. And that's basically what Neil's describing. It's intended to cause the body to go readdress this area that it probably didn't address properly the first time, and try to regenerate tissue. And that doesn't necessarily mean it's going to, if you have bone on bone in the knee, that it's going to regenerate and grow you a new knee. But it's a term that basically shifts. It's any type of a product that you would put into a space where the body will respond to it, ramp up regenerative processes, and slow down degenerative processes into basically to a balance where you have a net positive instead of a net negative. And to delineate those, there's the prolotherapy, which Neil talked about, which is that's short term for proliferation therapy, and it's the kind of the most basic form of it, where you are putting in a mild caustic stimulus where the body will respond and say, hey, I may actually have an injury here. The body comes in, white blood cells do their thing, removes a little bit of scar tissue, ramps up regeneration, and then you get a second chance at re-healing the area. The next step up would be platelet-rich plasma therapy. And kind of going along with that is there's a umbrella term which would be considered stem cell therapy. And those ones are very similar in that they're still using the body's natural healing mechanisms to repair tissue, but they're much stronger at actually promoting the body to do work. And so regeneration of tissue is a lot more likely with those therapies than with just proliferation therapy.
What do you mean by platelet-rich plasma and stem cells? Can you tell us a little bit about those two?
Absolutely. So platelet-rich plasma is essentially just taking somebody's blood. It's just like a venous blood draw, like you would do for a lab. And you would spin that down so that you could concentrate the part of the plasma, which is the water part of the blood. You'd spin it down so that you would concentrate as many platelets as possible. And if you think of platelets, if people aren't familiar with that cell, basically if you were to have a cut on your skin, platelets will go in. They'll be the ones that stop the bleeding. They'll bridge the gap between the two parts of the skin that have been cut. They'll basically have all the underlying processes that will heal the tissue over time. The platelets are orchestrating that whole process. And so by concentrating down the platelets and re-injecting it into an area that didn't heal properly the first time or needs a little bit of help, like somebody that has osteoarthritis or they have ligament issues, ligament strains, the platelets go in, they activate local stem cells to come in and re-heal and regenerate tissue.
For the listeners, like imagine going to a doctor and the doctor says to you, we're going to have to open your cervical spine, your neck, and we're going to have to put some rods. You might lose mobility. You'll never be able to compete in jiu-jitsu. If you get into a car accident, you can get into a lot of trouble. Or we have nothing for you. And to me, this is like the crux. Imagine if instead of having to go through something that is as aggressive as a cervical fusion, you have a practitioner that is willing to maybe try a little bit of manipulation, maybe try a little bit of needles with acupuncture, maybe inject some prolotherapy, maybe you're a candidate for PRP or stem cells. And by using our clinical training, we're able to prevent this life-altering event. And that is the power of naturopathic medicine. We learned this at school. Eric mentioned having, I don't have all the tools. I have to piecemeal together this plan. Imagine having everything under one roof and being in close contact with, seriously, like some of the smartest people that I've ever met and being under their wing. It's just amazing. So I'm going to put you on the spot, Kelly.
Okay.
What is naturopathic medicine? I know you can read off of A&P, to you, what is naturopathic medicine?
Yeah, so obviously it's just, a different way of looking at medicine. For me, I'm all about educating the patient. Like Carly said, I think a lot of us love to educate and empower the patient. So it's really taking the patient into consideration. I mean, we're looking at them as an individual person and not just their condition, their disease. I think it's really important that the patient plays a significant role in their treatment because ultimately they're the ones that are doing the healing. It's their responsibility to get them to a place of healing. And we, as the practitioners, are just a tool to do that. So I really think it's honestly taking the mind, body, and spirit and putting that into your treatment plan.
That's awesome. That's awesome. And we do see a lot of this within the functional medicine world. For example, I specialize in thyroid hormone and gut health and things like that. But I do get a lot of patients who have seen 10, 12 doctors, and they've seen a functional medicine doctor that specializes on Lyme, or a functional medicine doctor specializes in, thyroid, or, and they come to me and I look at their labs or I look at, at their diagnosis and I'm like, dude, you don't have Lyme. You don't have EBV. Your thyroid is fine. And sometimes when we go see a doctor, if you have a specialty, like for example, Neil, you went to an orthopedic surgeon, you need surgery. When you have a hammer, everything looks like a nail. And that's what happens with specialization. I do have advanced training in hormones, and we do see a lot of hormone patients. But I also have that base where I can see the forest, not just the trees. And it's very important that we consider this when we're looking for a practitioner. And that's why naturopathic medicine was so attractive to me, because it's not about having this one focus and being hyper-focused on this. We are forged on a different fire. We are forged on the fire of removing obstacles to health, using the lowest intervention before moving to the next one, And we are experts in botanical medicine. We are experts in nutrition, in all of these different modalities. And we get to use all of our knowledge in order to help our patients. Carly, what's naturopathic medicine for you?
Yeah, so when I'm talking to people who have no idea what naturopathic medicine is, the definition that I typically use with them is that we're primary care integrative doctors who are trained to address all aspects of holistic health. And I really like that definition because, when you're talking to someone who is coming from a different frame of mind, who maybe all they really have experience with is the traditional healthcare models, I think of a primary care doctor as someone who you go to for pretty much everything, understands pretty much any condition that they could be presented with. And then they also understand what integrative medicine is too. So they understand that means that you're looking at different types of medicine, maybe some of the botanical medicine, Chinese medicine, Ayurvedic medicine, and things like that. But then I also like to pin in that last little piece about holistic health, because that addresses, what Kelly brought up about bringing the mind, the body, and the spirit into it as well, which is kind of an essential piece of really what we do and is what makes naturopathic medicine unique. Because you can be a primary integrative care doctor and not necessarily be addressing someone's spirit, their purpose in life, and those types of things that are so important for your health that are pretty commonly swept under the rug.
You hit right in the head, with that, you can have an integrative practitioner. But what that sometimes means is that, my doctor says I have inflammation, so they gave me curcumin. That frustrates me to no end, because we're just using, instead of giving you a pharmaceutical, we're just substituting a supplement for that. We see that over and over and over. Oh, my doctor says I have high cholesterol, but he's very holistic. So instead of giving me a statin, they just gave me, red yeast extract. Eric, I see you nodding. Why is that wrong?
Naturopathic medicine for me is basically just doing what works when it works for an individual patient. So it's basically picking the right treatment at the right time for that specific human being sitting in front of you. And it's as simple as that. So it's being trained in a lot of different things, because at different times in one person's life, they're going to need a lot of different types of therapies. And knowing when to use acupuncture is a lot more effective than knowing how to use acupuncture. Even if you're not the person that will administer the acupuncture, we are trained in knowing when acupuncture is most indicated, how it should help the patient, and how to do it safely. So if we feel like that's the best treatment for that time, we can recommend that and then have the discussion, kind of like what Kelly said, is you're having a discussion with the patient. They basically take their health into their own hands and they agree to any type of therapy. And as far as the difference between giving a curcumin versus an NSAID is really, that's just, for me, I yelled at.
It's so frustrating. I can see all of you guys. We're so frustrated.
You're really only taking one piece of the whole person in front of you, and you're treating one small part of that. And if you think that that's going to make or break the difference in the treatment plan, you're deluding yourself and you're deluding the patient.
Okay, Dr. Morris, instead of being, you have a headache, instead of giving you an aspirin, I'm going to give you some willow bark. You have high cholesterol, instead of giving you a statin, I'm going to give you red yeast rice. Why is that the wrong way of seeing this?
Well, let's say, for example, me. I had a headache because my neck issues. I did not have just treating my inflammation. Like you say, it's like saying you have a temperature, take Tylenol. Well, why do I have a temperature? You're just putting a Band-Aid, you're duct taping it. So if I duct tape it with naturopathic medicine, or if I duct tape with pharmacology, it's still duct tape. So that's what you get when you get someone who, I shouldn't blanket everyone, but someone who's done a 8-week course in functional medicine, they get an 8-week course. They didn't get the 4 years that we got.
I think that's the difference. And when I talk about being forged by the fire, when you are forged by a fire, that is, okay, you have this symptom, this is what you take. And you go through all your education, and one day you wake up and you're like, shit, like diet matters, sleep matters. And then you're trying to go back and take a couple of courses or whatever. That's when you're like, oh, okay, I get it. So instead of doing a pharmaceutical, I'm just going to do a supplement. And that's not the idea. And it frustrates me to no end. While we have gone through this training, we're taught to prescribe pharmaceuticals when appropriate, or prescribe, an antibiotic if you have an infection. But how do we prevent infections? Sometimes we need to prescribe statins and blood pressure medication. But in the background, we're working with lifestyle. We're helping people with their diet. We're helping people with sleep and all of these things that affect your outcomes. And that is the difference. And that's what I'm so proud of having you guys here, because this is the future of medicine. The future of medicine is going to be one where your doctor is going to say to you, you tell me when you need to come back, not I need to see you for the next 40 weeks because I have student loans. Now, speaking about all these cool things as naturopaths we do, I said I was going to come back to you, Carly. What is metabolic mastery?
So I think when most people hear the term metabolism, they think of how many calories you're burning in a day. But that framework is completely wrong. So we all understand what metabolics are. We understand that metabolics are these baseline processes that are happening inside your body at all times that are completely necessary to maintain life. So it's things like making ATP, making hormones, all these different processes that are happening all the time that you're completely unaware of. And it also determines, the anabolic activity. So things like building muscles, the building of hormones, the building of bones, stuff like that. And it encompasses catabolism as well. So this is breakdown of things like autophagy, whether or not you're going to be going into an osteopenic condition, things like that. So metabolism is really just this kind of like underlying process that really determines so much about what your health is going to look like. And as we get older, it determines how well you age, how long you'll live for, and not only your lifespan, but your health span as well. So how healthy and functional you're going to be for that duration of your life. So to me, metabolic mastery is understanding the nexus of all those different processes. So, your neurotransmitters, your hormones, and things like that, and then optimizing them through things like, the exercise, the nutrition, the botanical medicine, sleep hygiene, and everything. Yeah, so I really love, just the idea of mastering that metabolism, because I think as longevity goes, that's one of the things that can help you to live the longest and fullest life.
Wait a minute. So you're telling me that a 22-year-old college student doesn't have the same requirements as 60-year-old women? No. This can't be possible, because I read on a blog yesterday that everyone needs to IF. Everyone needs to intermittent fast. Everyone should avoid brassica family because it has oxalates.
Individualized medicine, man. I can't say it enough. It is so important. Know your patient. Know your patient.
And sometimes, as we age in the continuum of life, a person that is a CrossFitter, or they're, in their varsity team or whatever, is going to have very different metabolic needs than a pregnant woman. And sometimes, no matter how clean you eat, no matter how, you go to the specialty stores and blah, 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 you might still have some more metabolic needs. Kelly, can you tell us a little bit about vitamin therapy and, and the stuff that you're doing with like injections and IV nutrition?
Yeah, absolutely. So, I mean, my main focus is hormone endocrinology, but I do a lot of supplemental therapies like IV vitamin nutrients and B12 shots. So, a lot of that is basically replenishing our body with the nutrients that we need to maintain these baseline processes, like Carly was saying. So, it's really great IV therapy for really anybody who just wants to boost their immune system, have a little bit more energy. If you do have a specific condition, these vitamins and nutrients can be specific to you. So you can get your foundational health in order. And I think this is really important, kind of going into the regenerative medicine stuff too, which I also have training on. So we all kind of, are in that realm. But having your foundational health is so important, because if we don't have that in order, we're not going to be able to heal from these regenerative therapies. So I think it's really important that, you have these baseline things in order before you're injecting stem cells or you're injecting these other things, because the way that your body is currently working is the way that it's going to heal. So if we don't take care of these baseline things, like our nutrient levels and all of that, that's really going to affect these extra therapies that we do.
And I do see that a lot, that someone has some knee pain and they go to their physician or their doctor and they'll go, oh, let's do a $5,000 stem cell injection. And I scratch my head and I'm like, this person smokes and this person has like a really shitty diet and they're not exercising. It is an amazing therapy, but it's not a panacea, and sometimes you have to start very slowly in building that health bank account. And then once you have the vitality in order to regenerate, that's when that injection is going to be better. I've done some PRP and some stem cell, blood draws and stuff like that. And you look at the PRP and it's like cloudy and that tube looks sad, Re-injecting that stuff back into your body is just going to create more inflammation. Eric, can you tell us a little bit about your residency and the Neil Riordan Center?
Yeah, absolutely. So the Neil Riordan Center for Regenerative Medicine is actually part of or attached to the Southwest College of Naturopathic Medicine. So it's one of our home-based residencies. There's 1 to 3 residents there at all times. Currently, we have 2 because one of our residents is on mat leave. But it is essentially focused on, I do 1 year in general medicine and I do 1 year in regenerative medicine. So it's a 2-year residency program. However, with that said, I would say 80% of my workload right now is still geared towards the pain management and regenerative medicine side. But essentially what it is, it's just a full-time residency. I get 36 hours a week where I'm doing residency duties, helping the attending physicians on their student shifts, oversee students, see patients. Also with the attendings when they see their own patients, whether they're doing a stem cell procedure or a PRP procedure or something else, I will be assisting in all of those cases. And then I get 4 hours a week of my own time where I get to see patients and build my own practice, which is just enough to have fun and keep me interested. So it's a lot of work, but it's a lot of learning. And I think the learning curve for the first month was just outrageous. A lot of things that I thought I knew in medical school, you get out, you kind of put it to the test a little. And I think the fire that we're all hardened from that you were talking about, that continues, probably for 5+ years. I don't know how long it's going to last, but
hopefully 30, because I've been out, I'm about to start my 3rd year in practice and man, it's a joy to drive to work. Isn't it awesome?
Yeah,
now,
it's good.
Now, so I decided to do a residency. I think it was very important for me to do a residency, but then there's some like crazy people that they are in the middle of their 3rd year and they decide to open their own clinic. Neil, what the fuck, man? What were you thinking?
I don't know. It was not easy.
No. Well, dude, you sure made it look easy.
Mm-hmm. And he's got 4 kids, right?
Yeah.
Yeah.
And he's running
You're
for
my
president.
hero.
I strategically partnered myself with a very, very experienced physician that's been out practicing for a while. And then I also partnered with someone who was 1 year ahead of me in medical school. So the balance was perfect. Also, it allowed me to actually create my own residency, again, with a very experienced practitioner that's been injecting for over 20 years. And
Dr.
and
Van
then also,
Sinue, who
yes,
who
yeah,
taught me everything I know about injection therapies. That dude he's a sensei when it comes to that
yeah,
shit.
I was about to say he's a ninja. Again, like, you think you know something, and then whenever you get thrown in the room with your attending and the patient, and Dr. Nue I would just walk in the room and he'd be like, "All right, Neil, so what you're going to be doing?" And I didn't know I was going into the room injecting. And literally the patient's sitting there, and then I was just like, okay. And you go in there, and not only do I want to impress him, but at the same time, I do have that patient right there. So yeah, that learning curve of, all right, I'm injecting every single day now, like every single day. And sometimes you are, and sometimes you don't know you are. So it's been an amazing experience.
Tell us about your vision for your clinic.
So the name of the clinic is Regenerative Health Group. I went initially thinking I was going to be doing a lot of injection therapy, and I am. And something, that happened really quick, basically, a lot of the other people on the call that are, saying is you think you're going to be treating this 30-year-old CrossFitter that eats perfect and all this type of thing. And what really walks in is a 60-year-old diabetic that doesn't want to change their diet, has high cholesterol, that thing. And the very first thing you have to do is you have to, like, all right, you know what? I'm not going to inject you today. We need to get some lab work. We need to optimize you. We need to create a place where your body's ready to heal. And that's kind of where, with Regenerative Health Group, not only do we have a practice up front, we also have a venue space behind there where we have education. And then behind that, we actually have a botanical and edible garden that's opened up to the public. We wanted to create this center that encompass healing from all different areas, and not just a come in here and get your shot type of thing.
You guys heard it right. He opened the clinic before he graduated, which is just amazing. Beautiful clinic. The space is awesome. And that's another thing that I love about my profession. It really feeds into my entrepreneurial spirit, because I'm a lazy kind of dude, and if I was just clocking in, clocking out, seeing people in insurance, I would get pretty comfortable pretty fast and just cash in and really not help people in the way that we need to help them. I know you, Kelly, you have a really cool business model. Can you tell us about your what you're doing with your practice?
Yeah, absolutely. So within the last month, I just launched my own mobile medicine practice. It's called Scottsdale Premier Wellness. I'm located in Scottsdale, but basically what I do is I do house calls. So I'm there for the average busy person. I know so many people have a hard time making it to the doctors in the typical 9 to 5, office hours, or they're a busy mom, or, they own their own business. They just have a hard time making time to go to the doctor. So I provide the convenience for them. I do women's health. I do general wellness. I do a little bit of pain management. So I use acupuncture and cupping. And then I also provide the IV drips. So if you have a big event coming up, or you had a little bit too much to drink the night before and need some vitamin replenishing, I come directly to you guys.
And Carly, you went back to your hometown. You always told me you were going to end up back in San Diego. Tell me, what are you bringing back from the East? It feels weird to say that we're East, but we are back to California.
So there's a little bit of difference in training in the way that doctors in Arizona are trained from the way doctors in California are trained. So in Arizona, we have a slightly wider scope of practice. So I had the benefit of learning some things that I would not have gotten to learn had I attended the medical school out in California, which is cool because now, although I can't do some of those things out here in California, I'm more able to guide my patients to those appropriate therapies So that's things like acupuncture, some of the, intra-articular joint injections we can't technically do in California. But because I have training in that area, I'm able to talk to my patients from an educated point of view when those therapies might be right for them. So similar to Kelly, I do a mobile health service here in San Diego, obviously working on the metabolic mastery, the hormone health, doing IV drips and things like that. And the idea is to meet people where they are. Like Kelly said, we live really, really busy lives now. And the modern person is just totally bogged down between, work and trying to go to the gym, whatever. So we would consider this an obstacle to cure, right? Not having enough time. So if there's something that I can do to remove that obstacle to cure, which is the time, and meet someone either at their home or at their work or something like that, I'm going to do it. So really excited to begin treating the people of my hometown.
That's awesome. So anything I'm missing, guys? Anything you guys want to add to the conversation? Because sometimes I feel like I'm preaching to the choir when I have this, but I get like really riled up. So any parting thoughts? Where are you guys practicing? How can people get a hold of you? Kelly, you want to start?
Yeah, so actually a lot of my clients come through social media. That's kind of how I've been promoting myself. So I do have an Instagram that's slowly growing. So it's Dr. Kelly Lupo. I do have a Facebook page too. If you go to my Instagram, everything is linked. My website is drkellylupo.nd.com. All of my information is on there. You can contact me, reach out, tag me in pictures, tag me when I come to your IVs, your B12 shots. I just love having a fun environment and, getting out into the community and connecting with everybody is great.
That's awesome. Carly, Dr. Golightly.
Yes, thank you. So on that note, my website is Dr. Golightly, spelled exactly like it sounds. ND as a naturopathic doctor. So that's drgolightlynd.com. And then you can find me on Instagram at holisticfitdoc.
Dr. Nelson?
I'm probably the easiest to get a hold of because I'm part of a giant institution. I would call it giant. It's actually still a small business. But it's just called a Neil Reardon Center for Regenerative Medicine. It's 480-970-0. And I don't personally have any doctor social media right now. I'm very lazy with that kind of stuff. Even with my own personal stuff, I think I post once every three or 4 weeks. But I got to get on it. I know I see all you guys. I know Guillermo, you started this podcast a long time ago. You have been really good. All 4 of you guys have been good at that. So I'm feeling a little bit of the heat right now.
We'll help you out.
Yeah, get on it, man. Because you know why? Sometimes we feel that the term influencer or influence is like a negative. But if we are not the ones influencing, someone else will. And I know we're the good guys. And, there is so much misinformation when it comes to, supplementation and diet and exercise and all of these things. And people that don't have any training are out there killing it, which is a bad term to use, but they're crushing it. Another bad term. The real information, the truth, gets left behind. So I challenge you guys, as the future of naturopathic medicine, to be the leaders in this movement, to influence people with your kind heart, because I need allies on my side in order to have the health outcomes that we deserve. Dr. Morris, what about you? Where can people find you?
So I'm at Regenerative Health Group. Our phone number is 855-34-RELIEF or 855-347-3543. I'm on Facebook. I'm Dr. Neil Morris. I think it's Dr. Neil Morris, NMD. Facebook has certain rules. You know how they won't. Yeah, I can't.
Well, I'll put all your contacts on the webpage.
And then on Instagram, I'm Regenerative DR. I haven't been as good on social media as I should be. A part of it is just because of I got an overwhelming influx of patients from the jiu-jitsu community. So like literally because they've seen me get injured and stuff like that, and they've seen me come back, and it's
that's a great problem to have, Neil.
Yeah,
it is. I didn't realize how many like knees and wrists and shoulders that but I definitely got to get more on social media. I've done a couple posts, but I really have. Like you said, we need to be out there spreading the truth as much as possible.
Mm-hmm.
Guillermo, I'd like to know before we let you go or you let us go. I would want to know how you think about your podcast now versus when you started it.
It's the most satisfying thing. I get to reach thousands of people. I get patients coming in from all over the country because of my podcast. But if I had to do it all over again, I would do like seasons, and then I would do like 12 episodes, and then, every 4 months or whatever, you just release 12 episodes. But I release an episode almost every week, So because of that, there's a lot of stress in my life, trying to look for guests, but it is just so awesome. I've been following podcasts and social media stuff, for a very long time, since 2008. And when I started my podcast, almost 4 years ago, I wanted to restart this whole health thing because a lot of people were left behind. You're talking about people talking about metabolic flexibility, people talking about intermittent fasting or all these crazy things. And I remember having a patient at S01E09, and I was like, oh, you know what? Let's start a paleo diet, and you're going to be gluten-free, and you're going to be, and I want you to eat healthy fats, And a couple of weeks pass by, she comes back to see me, and she's like, I didn't do anything because I didn't know what a healthy fat was. And I was like, damn, I've been in this echo chamber for so long that I forgot that outside of, the S01E09 campus, people actually smoke. It's like, what? And so I wanted to provide to my patients or to people, sometimes finances can be an obstacle to health, or distance can be an obstacle to health. So I wanted to give as much information out there. I wanted to put my philosophy of practice out there, and I wanted to, make sure people knew how I treat it and why I chose my profession. And I think it has been so rewarding, and I'm never going to stop doing it. But it's overwhelming at times. But it's just like medicine. It is the most rewarding thing ever. I love driving to work. I love seeing my schedule in reconnecting with people that I've treated, or seeing a new patient, and I go and I look at their labs, and I'm like, wow, this person is gonna have the best outcomes. But if someone asked me, would you go to school again? I'd be like, hell no. Nope. I'll go, I'll become an accountant or something, because that's way easier. But the amount of joy that I get from treating people and sharing this knowledge with people and getting emails or people seeing me do a presentation or a summit or whatever, it's just so awesome that I'm not going to change anything, but it can be pretty crazy sometimes.
Quick thing. I just want to say this because there was a patient that he referred over that I saw, and we started talking about him a little bit, and she said, Dr. Ruiz saved my life. And when she said that, it like gave me chills. I was just like, that's such a cool thing for someone to say about someone else. And that to me is like kind of embodies naturopathic medicine. Like people, they go, like you said, they go to all these different doctors. And then when you have a patient come in there and talk about one of your colleagues, and at one time was an upperclassmate, and I was like, that's cool. You know what I mean? I was just like, that's so cool.
A lot of the times I see patients that, you see their labs, and you're like, what the hell? And they take 40 supplements and they do this and that, and and they're doing all of these crazy things, like you, Neil, that you needed surgery, and they're anemic. And just looking at their labs, you could see that they are anemic, they're functionally anemic, or their thyroid is off. Do you guys have any experience? Let's do this as the last question, and then any experience, any in your training, seeing patients at S01E09 that you were like, wow, this is it. This is how I want to treat people, because sometimes we get really fancy with stuff. And in reality, the patients that I'm seeing that are coming all over the country could be treated better if someone actually had time to sit down and look at their labs. If somebody had time to actually talk to them. And that's when I say, sometimes I see those labs and I'm like, damn, this patient is going to feel awesome after we finish treatment. Because what we're doing is not magic, it's not witchcraft, what we're doing is evidence-based medicine with that touch of personalization that I've heard every one of you guys mention. So Kelly, any particular patients do you think about?
I don't know if I have a particular patient, but I mean, I found this so often with so many patients that I saw, even as a student when we were still learning. I know one patient, she had a whole array of autoimmune conditions. Honestly, her problem was that she just had so much inflammation in her body. And, she was thrown around to 10, 15 practitioners and, wasn't really getting the help that she needed. And honestly, it took a 2-hour appointment. I ran way over. Dr. Wolf wanted to kick my ass. We just needed that time to sit down and review everything. I think that's the biggest issue with the conventional side of medicine is our time constraints with our doctor. I just talked about this on one of my Instagram stories, is that we just don't get enough time with our doctor to really just sit down and look at everything, look at what you've tried, what you haven't tried, and looking for those patterns in your health throughout all of the organ systems. And I think that is where naturopathic medicine thrives, because we are looking at everything completely and holistically compared to just one minute thing at a time.
Dr. Nelson?
I think I have a lot of these because I think you and I probably have a pretty similar philosophy on how to treat people. And it's generally, simple therapy is very effective. One gentleman that I'm thinking of also on a Dr. Volk shift when I was a student, new patient, seen probably last quarter, maybe second from last quarter that I was a student. And he came in with, again, a whole binder full of medical records, a list of chief concerns. And we just had to kind of talk and lay out what he wants from us. And really simply, how can we help you today? His biggest thing was that he was in a lot of pain. He wasn't sleeping. He was really anxious. And so you kind of choose where you're going to start with that. And for him, it ended up being that his wife had such severe sleep apnea that she would snore. She would kind of have little apneic bouts during the night that would wake him up so frequently that he wasn't getting any good sleep. And then the next day he would be in more pain because, as we know, sleep and pain is closely tied. And so we did a little trial where he actually slept in the guest room for a week. It was just 1 week, slept in the guest room. His pain just went way down. His mood went way up. He was more himself. He felt like himself. By feeling like himself, he actually was able to go out, play with his grandkids, be more active, eat better foods, just everything kind of a little bit better just by a little bit of space from some snoring. It's like such a simple thing.
That's where we miss it, where if you have 5 minutes to do a consult and you're like, you can't sleep, here's your Lunesta. You can't sleep, here's your melatonin. And that's not cure. It can help. It can be an addition to, while you're working on the divorce papers, because, they obviously have to get divorced. Well, a little bit of melatonin, a little bit of GABA, things to help you fall asleep faster. But eventually the goal is that maybe you need, a multivitamin and sunlight. And that's it, You cannot get to the root cause if you don't have that time, that contact. How many times have you guys heard, this is the first physical exam I've had?
Oh
yeah.
Man.
A lot of times, many times.
And that's incredible. Dr. Golightly, any patients that,
Yeah, I have one woman specifically that stuck out in my mind immediately once you asked this question. So this was during my my fourth year. I can't remember if it was the second to last or the last quarter. She may have spanned both, actually. She had severely uncontrolled asthma to the point where she couldn't even get up and walk to her dishwasher without feeling out of breath. So obviously having a huge impact on her quality of life and absolutely terrifying for her. So in talking with her, like Dr. Lupo mentioned, we get an hour and a half to talk to these patients and figure out what exactly is going on. And I figured out in my intake with her that this asthma had gotten worse when she had been in the hospital with her mother. And the acute stress of being in the hospital with her mother had actually aggravated all these asthmatic symptoms for her, and she had never been well since. So for naturopathic doctors, that whole never been well since statement, that's really big for us because that's a huge indicator of where we need to look. So since she had told me that, obviously we worked on her immune system, because if she's having an asthmatic response, that tells us that there's some kind of trigger happening. And we also used a little bit of homeopathy, and then we used constitutional hydrotherapy. She had also been on some pretty large doses of prednisone for her asthma attacks as well. And we were able to give her a little bit of DHEA to help, combat some of the side effects that the prednisone has. So for this patient specifically, her goal was to be able to dance at her daughter's wedding. And we had, I think, about 2.5 months to get her there. She was one of the last patients that I saw before I graduated. And so when I saw her at this very last appointment, her daughter's wedding had been the weekend beforehand. And she came in just tears pouring from her eyes because she had danced at her daughter's wedding and had an amazing time and had had no breathing difficulties whatsoever. So huge success story. It was amazing. We cried in her appointment. It was awesome. Even talking about it now, those are the moments where I'm like, I'm so glad. There's nothing else in the world I would want to do with this.
Yeah, that's awesome. Neil, any particular patient that comes to mind?
So not a particular patient, but literally this past month, the theme has been symptomatic with low normal labs or high normal labs. So like they're symptomatic and then their physician just looks through their lab. There's nothing flagged. They're like, you know what? Exactly like what you said. You're like, you know what? You just need to sleep. The reason why you're tired is because you need to sleep better. Here's your Lunesta, or whatever. And they just write their script. They come in with their sleep pill. They're like, I'm taking it, but I'm still waking up. I actually feel more groggy now. Now I feel drugged. And it's like, you look at their testosterone and it's like 500. We're talking about a guy and their testosterone's 500. And then you're like, well, you're 40 and 500 is kind of low for a 40-year-old. Did they test anything other than your total testosterone? And they're like, no. They're like, well, let's do some more lab tests. And then you find out that their sex hormone binding globulin is like 80 and their free testosterone is non-existent. It's like, you know what? Your testosterone of 500 is kind of low for being 40 and fit. But not only that, you have no free testosterone. You know what I mean? So you're working with nothing. It's, you see these physicians who don't dig just because it's like, you know what? Your lab work's normal. You need to sleep or decrease your stress. Like, it's like, just decrease your stress. All right. Stress gone, type of thing. So, yeah, I mean, it's really looking in and listening to your patients. And if there's symptoms, just because the lab work says it's normal doesn't mean that it's normal for them.
That is optimal.
Right.
Yeah.
Optimal.
Yeah. So even if the labs, are, and that's the problem, you have 5 minutes. The only time that you have is to make sure that A, they're not dying, and B, to make sure that nothing is flagged. If you see those labs and nothing is flagged, the only other recourse that you have is to go through your training and figure out which medication was appropriate for that particular condition. Unfortunately, this is the system that we've created, and this is how it works. And, I love my, all my practitioner friends. They do amazing things, and they are helping people. But if you really want to get that next level help, if you really want to level up, if you really need to find yourself a practitioner that is, looking at you as a person, not just as your thyroid, not just as your knee, not just as your testicles or your ovaries. And I think that right now, there's 4 practitioners that are ready to take over, and I'm really proud of you guys. And I hope to have you side by side for many, many years to come, because we are going to change the world.
Amen.
Amen to that.
Already.
Thank you for being here, guys. And I will put all your links on the website page for the podcast. And I'll see you guys soon.
Awesome.
Thank
Thank you.